we're a designated facility. So we're the only hospital north of Edmonton that takes all the patients that are certified under the Mental Health Act. So we get everybody from the north that exhibiting any type of behavior that warrants RCMP intervention or family intervention.
You are 50 times more likely to be assaulted in healthcare than any other industry in Alberta.
I've been present when we've had windows broken. Somebody tore apart our lounge area, like ripped off the TV, took a chair, smashed the windows. Numerous times kicking in the seclusion room areas where the doors are secure. Kicking to extreme where they've broken arms or wrists, hitting the walls. So we had an incident where we had a patient that was brought in by the RCMP exhibiting some aggressive behavior in the community. And he was brought in and he was wanting, and I specifically remember him wanting coffee late in the evening. And we typically don't give caffeinated beverages after a certain period of time because we're also giving sedative medication. So it kind of defeats the purpose of giving medication if we're going to just allow them to drink coffee all night. And he wasn't pleased with that response, and he was threatened to kill us. So he started kicking the door, and as we were standing there, I was standing there speaking to the nurse that was sitting there, the door all of a sudden popped open. And our first response was to hold it shut, and that's what we did. So 2 of us held it shut, 2 more staff came, and we were holding it as he continued to kick it because he realized at that point he had popped it open. And so we were holding it shut with our bodies, and there was 4 women on. And I remember at the time following, like there was probably 60 years of experience behind that door, like with the nurses that were on. This wasn't like brand new nurses. I was the youngest out of all of them that were on that day, like as far as experience. And I can't remember if somebody had come through the door and we just phoned the police. That's the only thing we could think of doing because we had security at the time, but our security was elderly ladies and men that were somewhere on seniors pension. I'm not kidding. That's who our security was in the hospital. They were not trained guards. They were not physically fit to, like I'd be scared for them going into a room. So we phoned the police and the police came and we did some statements and he had broke the door, like the frame of the door was broken. And so the RCMP said, well, we can charge him with mischief and uttering threats. And so first thing we said, well, we can't contain him here. Like this isn't safe for us. We can't contain him here. So they arrested him and he left the building.
And he pointed his fingers at the nurse as a gun and said, I'm going to come back and effing kill you. And he's taken away by the police. And one of the security personnel was taken to emergency in the hospital because they had an injury. And he was taken to cells. And then the judge ruled that he had not been released from the hospital as he had a mental health issue, so he had to go back.
And that right away the union got involved. I remember the president and the North District rep at the time was phoning like every person from the unit, okay, this is what's happening. What are your thoughts? Like, are you comfortable with this person coming back? And I remember getting that call at home because I was off that day. And I'm like, you're kidding. Like, how can he be coming back? Like, he threatened us. He kicked out of the door. Like, and I was so bothered by it. I started calling people that I was like, did you get the call? Like, what do you think of this? And I was in close communication with the unit and the staff that were on that day. So the next morning when they were told that he was coming back, the decision was made that we're going to take the rest of the patients off the unit and we're not going to provide care. 5 South is on the 5th floor of the hospital, the highest floor. So we took them down to the lower level of the floor to the staff lounge And we took the med cart. They took the med cart down there, and so everybody was cared for. They had their medications. They had staff there, and it left the one patient on the unit, which they refused to care for. The staff that were on that day did invoke their right to refuse work, but also taking care of the other patients. They made sure the other patients were taken care of, so they weren't refusing work for that unit, but that specific patient.
I want somebody to think about really what the right to refuse is. It means you are a worker, you're going to your manager and saying, I'm not going to do that job. And you know you can be disciplined. That was the factor back then. You could be disciplined, you could lose your jobs. Nobody in healthcare invoked the right to refuse. Like, this was a first.
There's, oh my goodness, like, this is our career, this is, I can't lose my job. There's a lot of fear, and it shouldn't be the case. Like, we shouldn't have to be fearful of losing our jobs to express our right to a safe workplace. We appealed and took it. It was a lengthy process with a lot of discussions and a lot of almost like court appeal hearings in front of the Occupational Health and Safety.
Because that was Section 35 of the OH&S Act, was that there was qualifiers. It could not be normal for if it was normal for the job, you couldn't invoke the right to refuse. And that's why management was saying that it was all right, that it was normal for the nurses to be slapped around and have death threats, and that's why they didn't have the right to refuse.
It was very difficult. Like, I remember being asked questions like, is it common that there's abuse on the unit? Is it common that there's violence? Like, is it typical of a patient which in some cases there is, but it doesn't substantiate that that's what my job is that I'm, go to a workplace expecting that there be violence and nothing in place to protect us.
When the counsel from the employer came out and said that it was normal for nurses to be hit on the job, spit on, assaulted, and that therefore it's normal, so they don't have the right to refuse, was shocking. And it really drove home that the employer's perception is that you're just a bunch of nurses on the floor and this is your job, so what are you doing? What's wrong? And that they were second-class citizens and that they didn't have any rights. And they're workers. They do have rights.
And to think that this is our environment, this is our work environment, it's the norm to have aggression and violent patients. It's not the norm, and it shouldn't be the norm that anybody be expected to come to work and expect a violent interaction.
The OH&S Council wasn't known for being friendly to workers. So this was landmark that nurses had refused, and then when we got the ruling, when the nurses won, like, that was better than cake and ice cream. Like, nurses are now believing they are people that have rights and are refusing to work in situations where they are being assaulted. And I think it's a great thing.